one of the things with CF life expectancy being increased recently is we're entering a whole new realm of problems that the doctors aren't used to dealing with. So we're actually entering a phase where people are actually living long enough to do things like have kids, which some doctors are for and some doctors are against. But it poses some difficult questions because you have to weigh out like lung function on the mom, for example. Are they going to be able to handle it? Also, just how is CF affecting the ability at all? So my husband and I have been trying to get pregnant for a couple years now. And it's just hard because of the cervical mucus, which is something that, is a fairly recent realization that, oh yeah, that's a problem because, people weren't living long enough to deal with that as a problem. And males with CF are usually sterile, just because of the way things work, the way that CF affects you. And so then if you are able to have kids, there's the question of, do you take your chances and have a child that could have CF because you have it? Do you test your partner to see if they are going to be carriers of the gene? Do you just flat out adopt? Do you do IVF, and selectively choose embryos? And it's been interesting to be part of a community that is kind of researching these problems that not much is out there about because they're new enough just because we haven't dealt with them a lot. And so I don't think there's one right answer to the do you have kids or do you not have kids and do you figure all that stuff out. I think it's totally a personal decision. My husband and I have decided that we're doing foster care because my body's having a rough time and that's what we're going to do. But I really admire the CF moms that I know that did have kids, that are struggling to take care of kids, especially when those kids have CF. I know a few of the moms in my Facebook group have kids with CF, and knowing what it's like to go through it, you wouldn't wish it on someone else, obviously. But when it is something that you get to deal with, it takes real courage to be able to say you're okay with that. And my husband and I have decided that we would like to take in medically fragile foster children when they're available, because I know so much about taking care of all of the medicine side of things. And there are kids out there that have struggles, and medically their parents can't take care of them right now. And hopefully someday down the road we'll adopt some foster kids. And I don't know what medical issues we may be bringing into our family when we do that. But I also know that my parents didn't know whether, I was their first child with CF. They didn't even know what CF was when I was born. But when my sisters were born, they knew there was a chance because they were both carriers. And I have one sister that has CF and one sister that doesn't. And our lives are all very different. But, my sister without CF just grew up with the vest that didn't work anymore, sitting next to us on the couch doing treatments and taking her little gummy vitamin pills when we all took our pills because she thought that was normal. And in some ways I'm like, oh, I'm sorry. But, in other ways, it's a good experience to be able to grow up with different things. And I want to give a shout out to anyone who raises a child with CF or with any medical difficulty, really, because it's hard. It's hard to deal with the medical difficulty just as an adult. To be able to take care of it in a kid requires a lot. And my mother is an angel. Just even now I turn to her with insurance questions and just like, how did you deal with this when I was little and you were doing this and that and stuff? But it takes somebody really special. So